Hello and welcome back. This is Dr. Burton Schuler. I'm a podiatrist, a foot doctor in Panama City, Florida. And this video today is going to be about a very common and painful condition known as gout. Gout is a chemical problem of your blood where you get an abnormal buildup of a chemical known as uric acid. Now, we normally have uric acid in our body, but when it builds up abnormally, it causes to be seated in, most commonly, the great big toe joint. It can also appear in the knee and the ankle. And what occurs is that when it's seated in these joints, it produces crystals that go into the joint space and causes excruciating pain. Now, gout will make the joint red, hot, swollen, and extremely painful. The reason you get gout is normally appears in men who are overweight, who can drink a lot of alcohol, or because of an excess meat or fish in your diet. That doesn't mean everyone who eats meat and fish is going to get gout, but those are people who do get gout tend to have a high diet of meat and fish. Another cause of gout is due to taking diuretics or water pills. And what occurs is that when you take water pills, the water in your blood is thinned out, and that allows the uric acid to build up quicker and become more saturated in your joints. Now, the number one symptom, and number one way that you know you have gout is that it is a terrible, excruciating pain. It is by far one of the three most terrible pains you can have. The way that I make this diagnosis of gout is very simply, I ask the patient, is this the worst pain you have ever had in your life? And if they say no, then there's a very excellent chance it might not be gout. The only two other medical problems that are as painful as gout are kidney stones and shingles. So all three of those are incredibly painful, but gout, most commonly, people will come in and tell me that they cannot even allow a sheet to touch their foot. It puts them into excruciating pain. Now, the way that we diagnose gout is when you go to your doctor, either your family physician or your podiatrist, they will take a blood test to see if the blood level of uric acid in your blood is abnormally high. If that is the case, then they can make the diagnosis of gout. But the more definitive and better test to find out if you have gout is when your doctor takes a little fluid out of the great toe joint and looks at it under a microscope. And if he sees these little crystals of salt or urate that is formed by the uric acid, then he knows that you have gout. You see, the reason for the pain in the gout is that these crystals act like tiny little itsy-bitsy knives. Imagine a large handful of salt being shoved down into a wound, and you could see how the cutting edges of those crystals can make you hurt. Now, as foot doctors, the most common thing that we see on a very common basis is that patients who are misdiagnosed with gout. Now, what occurs is the following. Many people go to their family doctor or a clinic, and for whatever reason, they don't take a blood test, or the blood test is dubious, or they don't take a sample of the fluid from the joint, and the doctor decides that they have gout because of the fact that their big toe joint hurts, it's swollen, and it's red. Well, that's not the only reason that your big toe joint can be very painful, swollen, and red. It could also due to the fact that your big toe joint, for a mechanical reason, has been beaten up and could hurt a great deal. Now again, the way that you make the differential easily is you ask yourself, is this the worst pain you ever had? It's not good enough just to say it hurts. This gout is the worst pain in the world. Going back to the misdiagnosis, well, the doctor will say you have gout. It will start you on one of the medications for gout. And it's not, again, unusual for foot doctors. Most foot doctors will tell you a story that a patient will come into their office and say, "Doctor, I've been treated for gout for years and years, and my big toe still hurts." And it turns out it's not because they have gout, it's because they have a mechanical problem of their big toe, another form of arthritis that is comes from the way that they walk. And again, most foot doctors see this on a daily basis. So it's important that if you think you have gout, you either go to your podiatrist or your family doctor, but make sure he either does the blood test or takes the sample of the liquid from the toe joint. But one final time, you could make the diagnosis yourself. I've never seen it not to fail in 37 years of being a doctor. Is this the worst pain you ever had? And if the answer is no, you probably don't have gout. Thanks for coming. In our next tape, we'll be going over the treatments for gout because there are numerous treatments and numerous medications. So until then, I'll see you when I see you.